Welcome back to Open Med School, Neurology Simplified. Today I will be discussing how the temporal pattern of a disease can identify the etiology. So, there are certain diseases we will take as examples. For example, one patient comes, he develops symptoms today. Yesterday he was normal, time period is clear, and he comes with a rapidly progressive or sudden onset or progressive disease and which lasts for a long time. That is a sudden onset, rapidly worsening neurological feature, and this is classical of a stroke. So, stroke produces fairly sudden onset, the symptoms last for long time, more than 24 hours, it is stroke. Patient may develop a recovery. Another type of presentation can be patient develops symptoms, sudden onset, it recovers within 24 hours. This is classical of transient ischemic attacks. Or a patient with a seizure, they can develop what is called Todd's palsy. So, two patterns we have studied. Third thing you will remember, somebody has got a gradually progressive disease over months, weeks to months. This is suggestive of a space occupying lesion. That is, somebody has got a brain tumor. They will not be able to exactly say when it started. It occurred over a few weeks, months, but it is not in years. So, this is suggestive of a intracranial tumor. Sometimes in case of some toxins, some nutritional deficiency also can present like this. So, hope these three patterns are clear to you. Next we take out another example. Somebody has got a disease, several years duration, slowly progressive. Take example, somebody has got a paraparesis, 10 or 15 years duration. This is never a space occupying lesion. This is something called what is called a degenerative disease. Degenerative. Classical example is the hereditary spastic paraplegia. Patient will have only one system affected. In the nervous system, one system, that is motor system, is affected. It progresses over several years. This is classical of degenerative disease. Next, another pattern we should now remember is episodic illness. In between, the patient is normal, episodically it is occurring. Classical example is a seizure disorder, that is epilepsy. That is, patient develops a sudden neurological deficit or a problem. It recurs, in between patient is normal. Another example is migraine. So, remember, coming and going, but it's of short duration. Think about epilepsy and migraine. Another example, the familial periodic paralysis, hypokalemic paralysis. Patient can have symptoms for some time, it improves, in between patient normal, again gets another episode. So, episodic weakness can be part of. The point is, in between patient is clear or patient is normal. Another example, patient can have symptoms episodic, that is, one symptom lasts for few days, again recurs. This is classical of multiple sclerosis, that is remitting and relapsing. So, the disease can remit and relapse, something similar to what you have already said. And in some cases, the remission may not be complete. This may go on progress, remitting with some progression can be there. So, multiple sclerosis should be considered whenever you get a recurrent episodes of problems, or sometimes in vascular malformation. And again, the point is differentiating between epilepsy, migraine, etc. is that here the symptoms and signs last for several days or weeks. It will not disappear within 24 hours or quickly it will not. Hope this point is clear to you. And sometimes another pattern can occur. So, the patient may be having a progressive illness, in between there is another episode, worsening occurs. This can classical example, suppose somebody has got a brain tumor, into the tumor there is a bleeding occurs. So bleeding occurs in a brain tumor. So the presentation can be gradual, over few days or few weeks, the symptoms starting suddenly worsening, and the patient may be presenting with a sudden problem, and it may be missed as a stroke. So hope these points are clear to you. So these are the patterns you should remember when taking the eliciting history. The first two the episodes we are discussed about symptoms localizes, and the temporal progression of the disease try to identify what is etiology. In the next session we will be coming out with some cases and the anatomy relevant to that. Stay tuned. Thank you.